Every number in health begins as a person. A mother, a newborn taking a first breath, a nurse who showed up before sunrise. "5 years ago, a question was being asked far from this room. How do we make sure care actually reaches her in a comprehensive and cohesive manner? Before there was a name, there was a problem. Technical assistance in Nigeria's health system was often expensive, fragmented, externally driven, and short-lived. The expertise arrived, things worked for a while, but then it left, and there was a return to status quo. The answer was a hub, one-stop shop, context-driven, cost-effective, and Nigerian-led. In 2018, 3 partners were asked to design it. By the end of 2019, it was signed and underway.
TAConnect brings some kind of paradigm shift and disruption to the way donors have funded programs previously. When we receive a request from the state, what we do is sit with the state to articulate this request and then find the best partner that is suited to providing them support through a competitive and transparent process. Then we go ahead to fund that partner to work with the state in filling whatever gap has been identified. And we also ensure that all our partners who are working in the state imbibe the principle of capacity building, right, and not capacity filling. It makes for a more sustainable intervention when the partners have gone.
From idea to institution, TAConnect took shape, even as the work was already underway. State by state, the engagements opened, across Kano, Kaduna, Nasarawa, Gombe, Lagos, and Niger. A rapid response facility went live. An independent review committee was established. In February 2021, TAConnect was registered as a legal entity, and in March, its first executive director was appointed. And on the 1st of July 2021, TAConnect stood on its own. Governance, operations, and finances fully its own. Independent, TAConnect did what it was built to do. It reached scale. It led the largest scale-up of group antenatal care globally. More than 1 million pregnant women across 1,500 facilities in 7 states. Antenatal care delivered individually, but in cohorts/groups. But the gaps went further. So TAConnect strengthened the systems a health center runs on via a 7-prong approach which ranged from data management, supply chain, HR, financial management, etc. More than 65,000 children reached with vaccination services. It also reached the children the system had missed, with life-saving vaccines and nearly 13,000 caregivers in Kano's hardest-to-reach communities. With the Federal Ministry of Health, it took life-saving maternal innovations to scale, reaching 400,000 pregnant women and treating thousands for the leading cause of maternal death. And it built its own infrastructure, a grants management platform connecting hundreds of providers, and an internal system to run it all on data.
Most of the function support to states are really technical assistance because we don't, deploy people to go and sit in the facilities. And so it's important that whatever we're doing builds capacity and doesn't just feel capacity. And then by the time they pack their bags and go, the state is back to square one. So it's important that, what TAConnect is doing in terms of the approach is really key, that a state demands and then TAConnect works with them to really, really articulate the actual need and then supports the state to address that need.
TAConnect had earned the trust of more than one funder and was ready to evolve. TAConnect had always been a hub, diagnosing the system's gaps, co-designing the fixes. Today it works through 2 reinforcing modalities. As a grant maker, it channels catalytic funding so governments and partners can test, build, and scale what works. And at the last mile, it delivers services directly, piloting innovations, generating real-time evidence, proving models that government systems can adopt and sustain. Implementation feeds strategy. Strategy sharpens implementation. One continuous learning loop. It shows up at the last mile now, in Gombe through Embrace, and across 15 states through Thrive, improving and scaling what works.
My aspiration for the TA Hub for the next 5 years, and that one, that the TA Hub and then the TAConnect is established as a credible organization where they can access specific TA around primary health care, where they can trust the TA Hub to provide capacity building support. And the second is that also the TAConnect continue to earn the credibility and respect of different strategic priority team across the foundation, so that those strategic team continue to see the value to request TA through the TAConnect, to achieve their Nigerian goal.
5 years ago, TAConnect was a question in a room. Today, it is the answer in 1,000 health facilities.
I think with the approach we're seeing so far and the results that are accompanying that approach, it's promising. It's early days yet, but it's very promising, and we think they're on the right path.
For them to sustain and start thinking about approaching other sectors as well, apart from primary healthcare component.
From an idea to an institution, and only now reaching its full purpose, bringing care all the way to her and building resilient health systems.